Um, Sorry, I was muted. So next, let's welcome Kan Ege and Bill Adams. Ege is an R-Shiny developer at Epsilon, and together let's explore the H2E app developed in collaboration with Boston Medical Center, aimed at exploring health equity in Boston. Thanks.
So hello everyone, welcome to our talk. In this talk, we are going to showcase the Health Equity Explorer app in collaboration with Boston Medical Center and Bill Adams. So Bill Adams, floor is yours.
Great, thanks very much. So I just wanted to start out by thinking a little bit about why is measuring and assessing health equity important. And a lot of our work at Boston Medical Center is driven by this idea that there are many things that contribute to a person being healthy. And traditionally, we've thought of those mostly being located in a clinic or a hospital. But in fact, as we all know, there are many things that contribute to having people be healthy or unhealthy. There's the neighborhood and the place that you live, that quality and the access to healthcare that you have, the community that you live in, the education that you receive, and your economic stability. And so the work that we're describing here is really about bringing those things together in a way that can help us research and study health and health equity. And just one study, although there's lots more, that shows in 2016, only about 16 to 20% of a person's health is determined by the healthcare they get, and many, many other factors are playing a role. And traditionally, it's been very hard to bring together the clinical data with the things about the places where people live for research. So next slide. The situation and the place where I work is a research hospital in the middle of Boston, Massachusetts. We're quite a large system, and we cover the majority of the inner city of Boston. We're a hospital, but we're also community health centers, and we use an electronic health record called EPIC to capture data and also to share data across the network for research. Next slide. So what we set out to do roughly 2 years ago now was to create a tool that would let us actually explore and study health equity within Boston using informatics tools. And the Health Equity Explorer at a very high level is a translational informatics tool, meaning we're really trying to bring research into practice. It's an R-Shiny app that supports self-service exploration, so people can do this themselves. We want to be able to model any computable health outcome. So if it's in the data, we should be able to model it. We want to include a very broad range of demographic, social, environmental, and clinical drivers of health, these things that I mentioned before that go beyond just the clinical setting. We want people to be able to view that data in the form of graphs, tables, maps, and advanced statistical analyses in R. And we want to make sure that this code is open source, so other people can use it, that the code is interoperable with other systems, that we use common data models, which I'm going to talk about in a minute, which are standardized ways of representing data. And ideally, we use common data models that, that is not dependent on a common data model. So multiple shared common data models could support this approach. And we sort of divide it up on the left as health outcome, advanced analytics, which is the statistical part, and neighborhood data, which is more of the mapping part. Next slide. And we use the OMOP Common Data Model, this project. If you want to learn more about it, go to odyssey.org. It's a common data model that's used across the internationally and widely used in the United States. It's a standard way of representing electronic health record data. And what we did that was novel is we did a bunch of work to link the places where people live with publicly available data about the physical environment, the social features, the educational resources, to create a model that brings together clinical data with social and environmental data. But for most people, this would be very hard to navigate. And so the idea of this tool is to make it much, much easier. And working with Epsilon over the last year now, we started with a Tableau application that was limited in terms of statistics and visualizations. We did a first phase last spring, and now we're wrapping up the second phase to provide a rich, interactive R-Shiny tool that will let people explore this type of data to come up with new research ideas and interventions. Next slide. Now I think it's back to you.
Yeah. Thank you for the great explanation, Bill. So let me talk about the architecture of the application a little bit. Shout out to Pavel Demin for creating this diagram and architecture overall. We use Shiny Proxy for deployment, and of course, we have everything Dockerized. In Shiny Proxy stack, we have 3 applications. First of them being main application and data validator for notifying the user if their data is compatible with the app, and Shiny Telemetry for measuring the user adoption. And we also have Redis for caching. And of course, all these containers need environment variables for connectivity information. We manage them by .m files. And then for development, we have a database stack where you can host your backup files, database backup files locally and spin up a database in your computer. But if you have a remote database, you can also connect to that directly instead of having the database stack. So let me show you the demo of the application. Here we have the home tab, and we have the other tabs that lets you analyze the health outcomes. In each tab, we have these global filters in the form of a sentence where you can select the equity dimension you want to analyze and specify the years for your analysis. On top of that, we have also advanced filters to filter this data by clicking this gear button, where you can select the variable you want to filter with the categories. You can also add attributes to your analysis to make it more interesting. For example, you can add, we have a lot of variables you can add, divided into categories and subdomains. Let's add age group here, and you can analyze the data with age group added in timeline structure, but also you can also see it in tabular view, and you can show the percentage of missing data here. And in Advanced Analytics tab, you can first explore the data by creating univariate regression using the dependent variable selected here and having an independent variable from the variable bank we have. And also, you can explore the data by analyzing the category counts for each attribute here. You can then go ahead and create a model. And as you can see, all inputs in our application in the form of a sentence, even the modeling. So the independent variable comes from global filters here. And then you can select independent variables, for example, here in race and sex, and your primary variable of interest. Then you can also optionally group the output or create an interaction variable. Let's go ahead and run this model. As you can see, it runs really fast because of the Redis cache we have. And you see the formula here and the estimated marginal means for the primary variable of interest you selected here, and the model summary for variance affiliation factor, model coefficients, and performance. And now here, you can also analyze your health outcome in place-based structure in the map. So you can see the Boston map here. I can also just go ahead and select something else here. And you see the patients who have been screened for colon cancer across Boston. And you can also compare the health outcome with attributes. For example, percentage of under 18. And it will create 2 maps side by side. And you can also go ahead and merge them into one with bivariate map, where you have 2 dimensions in one legend. So this is the overall of the app. We have a lot of things coming more. Thank you for listening.
Just one quick footnote is that this is synthetic data. Although it's meant to reflect and be representative of the city of Boston, it's not actually real data from the city of Boston, but it's what we use for development. It's really made things easier. Great. Well, thanks very much. and we welcome your questions.
Thank you, Kan and Mikael. And I would like to ask, what are your favorite best practices for Shiny development?
We used Rhino in this application, and when you use Rhino, you are forced to use best practices, actually. And I think my favorite one is the architecture in this app, that we have everything Dockerized. We have even a dev container, and everything ties well with bunch of containers working together to create this application.
Great. And one question from the chat.
My favorite way to use our Shiny is to work with professional software developers. They're awesome, and they make you much more effective, and you deliver things on time, and it's incredible. But you have another question, so go ahead.
Nice outputs of the maps. Which package did you use to create such maps?
It's ggplot actually, and I think it's simple and beautiful. But right now we are also making good progress on making them interactive with Leaflet. But in the demo that you saw, we are using ggplot too, and for the bivariate mapping, where you have the legend for both dimensions, we are using I think it was by class package for generating that legend and the color palette.
Great. Thank you for this great presentation. And you can continue on the chat and on Slack to communicate with Billund again. Thank you.
Thank you.